Hello everyone. Today in our series of Docplexus interviews, we are honored to have with us the founder and the chairman of Chellaram Foundation, Mr. Lal Chellaram. Mr. Chellaram is a qualified economist from London University. He is an entrepreneur and a philanthropist. He is also the chairman of the Chellaram Group. Mr. Chellaram initiated the group's diversification into ship owning and ship operations in the late 70s. He established the Chellaram Foundation in India and has several charities worldwide. Thank you, Mr. Lal, for joining us for this interview. So can you please tell us how you thought about this idea of the foundation of the Chellaram Diabetes Institute?
Yes. The family has been always very philanthropic in its history and tradition. And so when I was reviewing the different philanthropic options that we should diversify into, medicine was one thing that we thought we haven't done enough of in the past. And so when we looked at medicine and the medical field, we found that diabetes was an area where there was exponential growth in the numbers and there was no real specialized area where people were specializing in it. Normally, GPs handle diabetes, and we felt that it was necessary to put up a forum where there would be specialization in diabetes, and hence the formation of Chellaram Diabetes Institute.
So we know that it has been 5 years since you laid the foundation, and we know that it has done exceptionally well. So what are your plans on what else do you want to achieve with this foundation?
Well, one of the important factors was that we wanted to try to make an impact on. Now, there are 80 million known diabetics in India, and probably another 30 or 40 who are still not diagnosed. So that's over 100 million diabetics. Now, how to make an impact on 100 million diabetics? So that was our real objective, is trying to see how to make an impact, not just through patient care, but through research, through education, through awareness. And of course, more than 50% of our population is in the rural area. So we have to focus on the rural population, which is diabetic, and most of whom probably have not been diagnosed and don't know that they are diabetic.
So talking about the enlightenment of the rural population, the Chellaram Diabetes Institute is running an outreach program. So can you please elaborate on this program?
Yes. The program is completely free. We have 3 mobile vans which go out into the villages, and a model that is very different from any other rural scheme, because we work through the government ashas, and we have a hub and spoke model, which is very interesting because it overcomes some of the main problems of rural things, where doctors are reluctant to go out into the villages, where there are no accommodation facilities normally. And so this hub and spoke works very well. And I think it's been a very successful model. And the fact is that we have screened 850 villages. We have, in terms of patients, we have gone through about 60,000 patients. So in the course of the last 3-4 years, it's not a bad achievement, actually.
It's a commendable achievement, I'd say. You're just being humble. So you've also collaborated, your institution has also collaborated with the PHFI, the Public Health Foundation of India, and the Association of Physicians of India. So can you tell us more about this association?
Yeah, this is an excellent, I would say, public-private collaboration where we are working with this government arm. And we bring to the table something that each of us, so our job is to develop the curriculum, and we do that in the most sophisticated way and the most updated status that we can get the course up to. And PHFI then go ahead with their distribution network that they have and distribute the course to their varied doctors all over the country.
So you've also organized this International Diabetes Summit, which I must say it's a highly successful event in my opinion. So what was the notion behind this event and what do you want to do with this event further?
Well, it's part and parcel of our effort and one of the important pillars of our institute that we should educate and bring up to date all the doctors in the country. And this is just another forum for the same thing. Just like we go through Docplexus for putting our courses on the map of India. So we think that this is another venue and another method by which we can get the doctors throughout the country and bring them up to date with the latest in the field of diabetes, with the latest faculty from all over the world. And as you know, in this one we have faculty from the Mayo, from the Karolinska Institute, and we had the best faculty in India. It's not just that the overseas faculty are good, we have some brilliant faculty in India as well. And we've brought them all together and tried to make this event a really first-class event.
Indeed it was. And so is there any message that you would like to give a community of doctors?
I believe that doctors should spread their wings a little in terms of doing not just patient care, but they should also apply their minds to education and teaching paramedics, teaching other doctors, and also, if possible, involve themselves in some research. When you get a varied platform like that, then it's very satisfactory to the public, and I think it's very self-satisfactory to the doctors themselves.
Thank you so much, Mr. Lal Chellaram, for your kind words and for partnering with Docplexus. We are honored to have you on the platform.
Thank you. It was nice chatting with you.
Thank you.
Thank you.
To stay updated on our latest scale videos and interviews, please follow us on Twitter, like us on our Facebook page, and subscribe to our YouTube channel. Happy Docplexing!